A 65-year-old man presents to the clinic with increasing fatigue and weight loss over the past 3 months. He has lived in the USA his entire life and has never traveled. He reports mild right upper quadrant discomfort. Physical examination reveals mild hepatomegaly, palmar erythema, and small dilated blood vessels radiating out from his navel. Laboratory studies reveal ALT 85 units per liter, AST 96 units per liter, total bilirubin 2.1 milligrams per deciliter, albumin 3.0 grams per deciliter, alpha fetoprotein 750 nanograms per milliliter, normal being less than 10. An abdominal ultrasound shows a 5 centimeter heterogeneous mass in the right lobe of the liver. Which of the following viruses is this patient most likely infected with? Choice A, hepatitis A. Choice B, hepatitis B. Choice C, hepatitis C. Choice D, hepatitis D. Choice E, hepatitis E. Choice F, yellow fever. I'll wait 5 seconds and then I'll answer the question. It should be fairly obvious to many of you that this patient has a hepatocellular carcinoma. We're not trying to hide that in this question. You have several symptoms here that indicate some kind of hepatic failure. There's elevated liver enzymes. There's elevated alpha fetoprotein, which is pretty buzzy for HCC. And of course, you have the single big mass on the liver rather than it being a bunch of tiny ones, which would instead indicate like a metastasis or something. But the rest of this question is an epidemiological question, right? Because it's basically asking which of these viruses is most closely associated with hepatocellular carcinoma. Now, this is one of those questions where if you're an IMG, you might actually be at a disadvantage for this question because in most of the world and overall, hepatitis B is the most common association with hepatocellular carcinoma. However, in the United States, where this patient, I specifically wrote that he's from the US and that he's lived there his whole life, in the US and in most parts of Europe and basically most developed countries, hepatitis C is actually the most common association with HCC. So choice C is the correct answer. So yeah, this is just one of those epidemiological facts that you should know. Now, as far as this question goes, some of you are actually going to be very clever and point out the fact that, well, you asked which virus he's most likely infected with. So that means you can eliminate the acute infections, which is actually choice A, E, and F. Hepatitis A, hepatitis E, and yellow fever are all acute infections. They don't really cause chronic infections. That certainly is one aspect of it, but most importantly, you just have to know that if you're in the US, hepatitis C is the most common association with HCC, not hepatitis B. As for the rest of these, it's like, okay, choice A, hepatitis A. Obviously that's just like an acute hepatitis. You get it usually from consuming shellfish. That's usually the most buzzy way they like presenting it on step exam. Hepatitis D, obviously they like testing this with the fact that it's only something you can get if you already had a hepatitis B infection. Hepatitis E, as mentioned, is an acute infection and it's fecal-oral transmission. It's relatively low yield in my experience. They don't ask about hepatitis E very often, but just know that it's an acute infection. It's more often seen in India, Asia, and Africa. So if you have travel history, then maybe you might think hepatitis E. Yellow fever, I threw this in here basically to be a jerk and have a distractor. And I know there's going to be that 1% of you who see this video and are going to be like, oh, it's the only one that's not a hepatitis. That must be the right answer. Please don't use that sort of logic on the USMLE. Anyway, as far as yellow fever goes, you want to know that it's a flaviviridae. So it's in the same group of viruses as Hep C and dengue virus, West Nile, Zika. And most of these are transferred via mosquito bites. And I basically threw it on here because jaundice and hepatomegaly is one of the known symptoms you might get from a yellow fever infection. So in summation, know that hepatitis B is the most common association with hepatocellular carcinoma worldwide and in Africa and Asia. But when you're in the US and most Western countries, hepatitis C instead becomes the most common association. Hope you enjoyed this video. See you in the next one.